When did speech therapy begin for neurological communication disorders? Imagine a time when helping someone speak clearly was more about art than science. The roots of speech therapy stretch back to the 18th century, when people first started formally trying to fix speech problems like stammering. Early pioneers like James Ford offered basic services to help with speech difficulties, mainly focusing on pronunciation and clarity. As the 19th century rolled in, figures like Alexander Melville Bell and his son Alexander Graham Bell developed methods like visible speech, which used symbols to analyze and teach speech production more systematically. These efforts laid the groundwork for understanding speech as a complex process involving the brain and muscles. But it wasn't until the 20th century that the focus shifted more toward neurological causes of speech problems. After World War I and especially after World War II, many soldiers returned home with brain injuries that affected their ability to speak, understand language, or swallow. These injuries made it clear that damage to the brain could directly impact communication. During this time, the field of speech therapy began to recognize and treat neurological communication disorders like aphasia, dysarthria, and apraxia of speech, which are caused by brain damage or injury. In 1925, the American Academy of Speech Correction was founded, which later became the American Speech-Language Hearing Association. This organization emphasized the medical and neurological aspects of speech disorders, helping to develop standardized diagnostic and treatment methods. Over time, speech-language pathology became a scientific discipline, with research guiding practices and licensure ensuring quality care. Today, speech therapy is a vital part of managing neurological conditions, including those caused by brain tumors or brain injuries. Speech-language pathologists assess and treat difficulties with speech, language, and swallowing, aiming to improve communication and help individuals regain independence. This evolution reflects a deeper understanding of how the brain controls speech and how therapy can support recovery and quality of life. In summary, speech therapy started in the 18th century with a focus on speech impediments. Its neurological focus developed mainly in the 20th century, especially after the World Wars, when brain injuries highlighted the link between brain health and communication. The field has grown into a science-based practice that plays a crucial role in helping people living with neurological conditions today. Always remember, if you or someone you know is dealing with speech or communication challenges related to brain health, consulting a qualified speech-language pathologist is the best step forward.